Welcome to the Behaviour Speak podcast. Now, here's your host, Ben Ryman.
Welcome to another episode of the Behaviour Speak podcast. I'm your host, Ben Ryman. Today is a special episode, at least for me. We've been doing a lot of interviews, primarily with board certified behavior analysts or folks that are kind of working towards certification. Mostly folks that kind of work in kind of that ABA sort of field, and it's been great. We've had some really great conversations. One topic that's been coming up a lot, both in the interviews and kind of in a lot of the social media discussions that I've been involved in of late, is things kind of around ABA reform, taking another look at kind of how we, treat the folks that we spend most of our time working. Most of the BCBAs in our field tend to work with folks on the autism spectrum, folks who are autistic, and so there's been a lot of conversation lately about kind of how can we do better in terms of both including autistic voices in our research and kind of how we treat autistic folks, kind of trying to minimize or remove ableism and other sorts of things that we may not realize are happening but are happening. And in my kind of research, kind of looking for more information upon that, I came upon today's guest, Dr. Ariel Cascio. Dr. Cascio is a professor at Central Michigan University. And what they do is they teach ethics and research methods and social science and conduct research about sort of a lot of different areas of kind of autism and neurodiversity. But what they do specifically that I really like, because I didn't sort of get into all of their research, is they've been doing a lot of research lately on the sort of ethical autism research and kind of how we recruit folks and how we treat folks through the entire process. And it's a really fascinating sort of research that I think more BCBAs would really find valuable, and so I thought they would be a great guest to kind of have on and kind of share their story. So, welcome to the podcast, Ariel.
Thank you. Thank you so much for having me and giving me the opportunity to talk about my research today. I am going to talk a lot about this research on autism research ethics that I conducted when I was a postdoc at the Institut de Recherche Clinique de Montréal. And I've also done research before and after with autistic folks in a variety of contexts and a variety of countries, particularly in Canada, the United States, and Italy. So should have a lot of things to talk about, and I'm just really happy to be here and to get to communicate with your audience.
Really cool. And I forgot that was another piece was certainly hitting close to home. Dr. Cascio has been doing a lot of work with Dr. Jonathan Weiss, who I think a lot of our listeners especially our Canadian listeners, will be familiar with him and his work. And certainly in BC, I think he was I think we've had him out as a speaker a couple of times in some areas, and so I think that'll resonate well with folks as well. Before we kind of get into your research, I'd love to kind of know. I always kind of start with a bit of an origin story, and usually the origin stories are quite similar because they're mostly behavior analysts, and they all kind of have a similar kind of way of getting into the field. So I think it'd be kind of really cool to kind of hear your story about kind of how you got into your field and sort of what led you to kind of start conducting this kind of research.
I might have a bit of a different origin story. It's hard to think about an origin story. Sometimes I might tell it a couple of different ways. But one origin story that has really resonated with me for a while since I started doing this research. I started doing research involving folks on the autism spectrum in about 2008. And at the time, I was an undergraduate student. I was studying anthropology, cultural anthropology. I'd studied a little bit of, related fields. And I didn't have an incredibly personal connection to the topic of autism or the concept of autism. I don't identify as autistic myself. I don't have a diagnosis. I don't particularly have a child with a diagnosis or a sibling. I did know folks with autism or Asperger's syndrome at the time, so I did have some familiarity. But what really started to interest me in autism research was an article that I stumbled across kind of by mistake when I was doing something else and just getting easily distracted, and it was in a popular magazine of some sort, but it was published in about 2005, right when folks started talking about autism as an epidemic. And I, again, I had some vague familiarity. I had folks tell me, I have a diagnosis of Asperger's. This is what it means to me. This is what autism means to me. And just a little bit, but this was the first time I'd really seen a lot of popular coverage. And even though it was a little bit of an older article, I sat down, I read the whole thing, and I was really struck by the language that this article used to talk about the autism epidemic. And the tone of the article, to me as a naive reader, it really came across as, isn't it terrible? There are these children, they would rather play by themselves than play with other children. Isn't it terrible? There are these adults and they're really interested in this one specific topic and they keep talking about that topic, even if the other person's not interested and they don't pick up on the cues that the other people aren't interested. And when I read this article, the things that the authors were describing as terrible didn't sound very terrible to me. I recognized these things in myself, in my loved ones. The particular things this article was were focusing on, such as preference for solitude or strong interests, which not all autistic folks share, but that was what the message was at the time. And as I mentioned, I was already studying anthropology, and so from that perspective, I was really interested in this idea of like the cultural idea of what is normal and what is not normal, and what that not normal means. If it means genius, if it means geekiness, eccentricity, social awkwardness, a diagnosis. Which diagnosis? Is autism a medical diagnosis? Is it a psychiatric diagnosis? Are those two things? Are they the same thing? What does it mean for something to be in the DSM? These are all the things that I got really interested in. And since then, I learned a lot more about the many different things that autism means to different people and the many different ways that people experience their lives, things that people really are concerned about, like self-injurious behavior, or harming others. It's not all about the things that this article put forth as terrible that I didn't think were terrible. But I still was really compelled by this framing of certain things that didn't seem harmful as an epidemic and as something terrible and as something to combat. And that's really how I got started with this research.
That's really cool. That's interesting. I mean, we're talking, at least 15 years ago that you kind of read that article and we're, kind of having these perceptions. And this is the exact kind of language that we're hearing right now, particularly, I think, in sort of these social media kind of circles where I think a lot of autistic folks, tend to flock to kind of get their message out. And the talk has been just that about sort of, and I think part of this I think feeds into the ableist argument where upon diagnosis, the diagnosis is delivered to parents more often than not as bad news. And so right at the very beginning, the very first moment you learn about the diagnosis of sometimes your 2-3-year-old child, it's a bad thing. Bad things are going to happen. You're going to need help. You're going to be stressed. You're going to be depressed. You're going to have all these problems. And sort of that pathway is set by the diagnostician and is continued, in a lot of the services that they get. So it's just interesting that 15 years ago you read that, and yet today folks are still pointing that out like it's a new thing.
Yeah.
So from there, a lot of this it seems like a lot of the work that we're going to kind of talk about today is coming out of. Actually, I think all the work we're talking about today is coming out of the work you've done with this team in Canada. So, can you tell us a little bit about kind of how that team formed and who it's made up of and sort of all that sort of stuff?
Yeah, so I got involved with this team in Canada in 2016. So I'd been doing autism research for a while at that point as an anthropologist who studies the social world of autism, social and ethical issues related to autism. I finished my undergraduate degree and I went on to get a Ph.D. in anthropology. Did some dissertation research with adolescents and young adults on the spectrum in Italy who are accessing autism-focused services, things that were really targeting folks with autism specifically. And then I saw the opportunity to join this team in Canada as a postdoctoral researcher. And the project that Jonathan Weiss and Eric Grissen, who's the director of the Pragmatic Health Research Ethics Unit, Pragmatic Health Ethics Research Unit, I apologize, at the Institut de Recherche Clinique de Montréal, they were looking to do some participatory research with autistic folks and other stakeholders, other people who are interested in this topic of autism research ethics, around proposing best practices that researchers could use when thinking about, when doing or planning a study that would involve participants on the autism spectrum. And so I was really interested in this project because it really combined the work that I had been doing with autistic folk and some participatory research that I had been doing in another field, making this more participatory autism research. Because I always thought that was something that I could use more of. In my own research. I'm still developing, still think I can use more participatory approaches in my own research. So I really jumped at the opportunity to join that team. And where Dr. Weiss and Dr. Rassen were coming from with this study is that they had long been involved with a network of researchers that I became involved with as well, the Kids Brain Health Network, which focuses research on neurodevelopmental conditions, one of which was autism spectrum condition. And a number of researchers were talking about, wanting more guidance in terms of how to do ethical research involving autistic folk. And this is something that I also saw a need for. There had been a few more things published, in the 20-teens. But when I was really planning my dissertation research, 2010, 2011 or so, there really wasn't very much out there. And so I thought this was a real need that people could use whatever kind of research they're doing. I was doing anthropological research. Other folks are doing clinical research, behavioral research, genetic research, all sorts of different things. I think we could all use some of this guidance and some of this insight. And we, in this team, are really committed to a collaborative approach to addressing ethical issues, to identifying ethical issues and proposing solutions and exploring those solutions in the real world. So we pulled together a task force of people with an interest in autism research ethics. So we involved potential research participants, so autistic people, autistic self-advocates, autistic researchers. We pulled in researchers who study autism, some of whom are autistic and some of whom are not. We pulled in professionals who work with autistic people and parents who have whose sons and daughters are on the spectrum. And these people often act as gatekeepers for research. So researchers might ask, for permission to ask the autistic person that someone knows to participate in research. And we also had representatives from advocacy organizations who, of course, represent autistic folks sometimes, but also may have this ask for research as well. And so we had a diverse group that we brought together. We really looked at a number of different perspectives, but wanted to have this productive conversation around what are the ethical issues that folks see in research and what are some of the strategies that we could try to create a research environment that's ethical, that's accessible, that empowers people to contribute to research meaningfully and safely. And so I'm really grateful to everyone who talked with me on this team and talked with each other on this team and worked through this process to come up with the report that we have, the suggestions we have for researchers, and to continue to reflect on these issues to this day.
Cool. Before I kind of dive in a little more, can you just sort of explain what you mean? And it seems pretty straightforward, but I just want to double check. What do you mean sort of by participatory research?
Sure, absolutely. So participatory research is an umbrella term. It can encompass a number of different approaches to research that have varying levels of involving people that might be participants in the research or from the same communities as participants in the research in other stages of the research process. So this can mean in the design process or the prioritization process, like deciding what's an important thing to research, coming up with the question, can also involve acting as, researchers as part of the research team, collecting data, analyzing data. In this project, this was ethical deliberation, so a bit distinct from a data collection and analysis format of a research project. In this project, the participatory nature was to deliberate, to go through a process that we call moral deliberation or ethical deliberation, to brainstorm ethical issues, to review the literature, which the three of us conducted a literature review. I spearheaded that, and reflect on what might be missing, and then to propose these best practices. But it does cover a wide range of research, and that's actually one of the things that we talked about a lot, is how researchers could engage autistic people throughout multiple stages of the research process, not just as research participants. So that's extremely important.
No, that's really cool, and I think that's something again that I think that I've started to see some of the autistic folk and sort of so-called kind of neurodiversity affirming folk being kind of calling for is so I'm thinking sort of just using kind of ABA again as a context. Maybe we're doing a study on some you referenced self-injurious behavior in the beginning. So say we're doing a study on, SIB, the idea that we would sort of just recruit folks and start studying them, but none of that process would include autistic folks. The idea, the question you're at, the research question, the data analysis, all of that. And that's what folks are kind of really calling for these days. So that's really cool that it's a thing. So, that people are already doing, in other fields. And so, I think that's a really important message to folks. What I love about, get to that in 1 second. The articles that we're looking at today look at three areas that I think are just so powerful and again really important for kind of anyone, but particularly I think again in the behavior analysis field. So the first article we're going to talk about is the one you've started to reference already, related to kind of creating some best practices in terms of ethics. We're going to touch on that one. This other one on intersectionality, which is huge right now, and a huge topic right now. And there's been a lot of been some other interesting podcasts which I could share sort of in the show notes that kind of touch on this piece. And then another one which the title of the article is Empowerment and Decision Making, but more so I think which I think is great, but I think a big piece in this article that's really important that I really want to touch on is these concepts of assent and consent, which is just really huge right now. Related, so going kind of the first article, one thing I loved kind of right away is you're walking the talk as you do the research. So you're doing research on including autistic folks in research, but you're also right from the beginning of this study, even in terms of sort of recruiting and including these different task force members, you're already applying some of these strategies on kind of the I don't know, the sort of the second or third page of the article, depending on what font
version?
you use to print it out or whatever.
Right.
There's a nice little table of strategies used by workshop organizers to facilitate access inclusion for those task force members. And so I just want to read this list off, because I just think it's amazing. Use clear language and formatting, of course, but this one, send detailed arrival instructions, including maps and photographs of the airport arrival terminal from a first-person point of view. Solicit and share photographs and biographies of workshop attendees and staff. Prepare read-along copies of presentations distributed in advance during the workshop. Present and discuss guidelines for engagement and conversation during the workshop. Provide multiple ways to engage, such as attending one, both, or neither days, having large group, small group, teleconference, written commentary, and best of all, make available a kind of quote unquote quiet room. I just thought this was just, first off, this reminds me in a lot of ways, and for folks that that might be designing a sort of a behavior support program for an autistic individual, I see visual supports here, I see sort of kind of written descriptions of things in concrete detail. So a lot of these strategies that we kind of use already, for behavior support, you're kind of applying, in a different way to the task force participants. I just thought that was really cool.
Thank you. Yeah, this was a very iterative process. We were developing things, but also building on things that were previously developed and going back to, each of those phases throughout, right? Kind of cycles. So in planning the workshop, I had already worked with autistic folks in a variety of contexts, as had my collaborators. We engaged with, in conferences, in academic conversations, and community conversations. So there were, some folks we already knew, some connections we already had. But the other thing that I think is really cool about doing this kind of research, for anyone who wants to get into doing research involving autistic folks, is that there's also a lot of really great resources out there. And as I said, increasingly so. There weren't when I really started this research, but there's increasingly more work out there. So we got a lot of inspiration from the Autism Cooperative Research Center's Inclusive Research Practice Guides and Checklists. This is a cooperative research center out of Australia. And so they have some guidance, including very clear checklists for, having workshops or events to get community feedback, because we talk about that being important, get community feedback, but you have to know a little bit in order to most effectively get that community feedback. And so there is some stuff out in the literature, and our stuff I hope we can contribute to their existing some of this literature, so that researchers don't have to start from square one. Although there will be always more specific things to learn, within your specific context, the communities you're working with. And we had, I'd also say, I should mention this, we had folks coming in from a wide geographic range across Canada. And so, yes, we also took those photographs at the airport to show really how are you getting from when you land to when you reach us, so when you come into to our office. And I'll also say we did get a lot of insights from, clinical ethics, from medical accessibility. There's other areas outside of research ethics where people have been focused on accessibility, like how do you create an accessible emergency room that still touches on some of the same common threads. Research is a social context, so is therapy, so is the emergency room, so is the dentist's office, so is a park, so is a transportation system. So there's some things that we see in common there as well, focusing on sensory, including multiple ways of communicating information visually and verbally, these things that people are already using in other contexts. We saw easy applicability within the context of our project as well.
If you're planning on collecting continuing education credits for this episode, you'll need to go to www.cbiconsultants.com/shop and enter the 3 secret words. The first secret word is diversity.
Yeah, that's cool. Another thing which, I think folks think about, but they don't always acknowledge is, and I wouldn't be surprised if there were members of that task force that, didn't identify as autistic that also found those things valuable.
Absolutely. I have been using these tips since, right, these strategies, since then, I often have maps and visual guides for how to get to my office. I was doing that when I was working at the IRCM, the Institut de Recherche Clinique de Montréal, and people had commented that that was really helpful. So I'm using it now in my office at Central Michigan University. And recently, it was in 2020, but recently I moved to a new location, and one of the first things I did was print out a map of how to get from the main building where my students have most of their classes to my office. Because it's just helpful for anyone, especially when I'm no longer right next to where they are all the time, just to show, this is how you get in here. And I was looking the other day and I thought I should take a picture of the door that you have to go through in order to get to my office, because that's confusing too. If you ever come to Michigan, I'll show you. But it's something that I use for everyone as part of a universal design strategy, because anyone might benefit from having a little bit of a visual guidance, instead of an office number to come and find me.
Absolutely, and we won't veer down this tangent too far. But you touch on you used a phrase that I think some folks will be familiar with around kind of universal design, and universal design is something I think a lot of folks will have some idea about. But folks don't realize that these sorts of inclusion and sort of accessibility, type adaptations that are made to environments. Well, they're certainly, I think, initially designed to benefit those folks that have, more barriers. People don't realize how helpful they will be to everyone, and how life is made easier. I think people walk into sort of an accessible building and don't think about sort of, oh, this is going to be great for the guy in the wheelchair. They just think this is a really well-designed building. I wish more were like that. And so, I think that's just an important point again, that universal designs aren't just for this one sort of, minority, or disabled population or whatnot.
Yeah, in disability studies, we call it the curb cut effect. So a curb cut is that cut out of the curb in the sidewalk, where
Right.
someone can wheel up onto the sidewalk from the road, like crossing the
Yes.
street, wheel down, wheel up. This curb cut is useful for people who are using wheelchairs,
Yep.
but also for people who are pushing strollers,
Totally.
pulling luggage, who, have all sorts of different needs. And so the idea with universal design, which has really come from architecture, but is applicable there's universal design for learning, for example, with teaching. We use a lot of those strategies, is that, the curb cut is more accessible to more people than having a curb to step up on. So why not have the curb cut be the default, so that more people can use the space?
I love the curb cut at the grocery store because it makes it so much easier to get the shopping cart to my vehicle. I mean, it's just amazing, but it's not made for that. It's like you said, it was made for the person in the wheelchair. So that's awesome. One other thing I wanted to touch on the broader scope, just around kind of how you do your research. And I know it's not only you folks that are doing this in research. I've started to see this a little more often now. Is this idea of a regular abstract and then a lay abstract underneath. I think that's just such a brilliant and really inclusive kind of concept, to just have a second explanation that removes the jargon, that puts things in, kind of regular kind of language. I actually prefer to read the bottom one myself more often than the regular abstract now. I find it easier to understand, easier to follow. I'm seeing this kind of happening a little bit more in research, where folks, I think, are a little more forward thinking. I think that's just a really helpful piece. I just wanted to add that.
Yeah, absolutely. And we're seeing that with a number of journals have a requirement. All of their articles will be published with some version of a lay abstract or a plain language abstract. And many even have tips and tools that you can use if you're not familiar with this kind of writing to check the reading level of your materials, and have suggestions for improving them a little bit, improving the clarity and shortening the words, using more everyday language.
Really cool. Okay, digging in a bit into this first article, and I'm not selecting these by date published, just more by order read by me, and so this one, and there was a couple sort of on this topic, but this one in particular is called person-oriented ethics for autism research, creating best practices through engagement with autism and autistic communities. Two things from the top that are kind of discussed in the abstract, and I think touched on in maybe some previous articles as well. First of all, I guess the first question is, what do we mean by person-oriented ethics?
Yeah. So person-oriented ethics and person-oriented research ethics, this is a term that Eric Rassen and I have coined and a concept that we've created that focuses on the relational aspects of ethics. So not the regulatory aspects like, oh, I have to do a study, I have to fill out my paperwork, I have to submit it to the ethics committee, and I have to, do my audit, all these things. Not the paperwork side of it, not necessarily the rules and regulations, but the experiential and relational aspects of research, and really looking at how research, as I mentioned before, is a social context and it's a relational context between the researcher, the research participant, and very importantly for us as well, broader communities. I often talk about these broader communities thinking about, like autistic people do all sorts of things. And one of those things can be participating in research, can be conducting research, can be consuming research. And that's something that we think about as well, is what is this research doing in the world? Who's reading it and interpreting it, and how are they using it? And so we wanted a model to really think about these issues and prompt reflection on these issues in research, which might be a little bit different than the questions that come up in a regulatory framework. And we were inspired by this concept of person-centeredness and person-orientedness that comes up in a variety of contexts. And so we reviewed some of those variety of contexts. In a clinical setting, there are patient-oriented and patient-centered approaches. In my own field in anthropology, there's person-centered ethnography. And so we brought together some of this literature in clinical ethics and some of this literature in research ethics, and looked at sort of the different ways that researchers are using person-centeredness or person orientation in their work as inspiration for what kinds of reflective questions we really ought to be asking. And so the model that we came up with, and from synthesizing all of this and looking at the gaps, is organized around 5 guideposts, is how we call them. So sort of things that can guide a researcher through this reflection process. So there is respect for holistic personhood. Respect for persons is a cornerstone of research ethics and has been for a long time. But we broaden that to talk about respect for holistic personhood, really considering the personal and interpersonal and biopsychosocial world of the participant. And for us, that really means valuing what participants have to share. Really recognizing that participants have something to contribute to the research process. I could talk about times when that doesn't happen in a bit, but to get through this first. And considering potential participants' needs and strengths. And so that's where we also do pull a lot of inspiration from some of these things that have previously been published on those needs and strengths, so we can consider them proactively. There's also empowerment and decision-making. As you mentioned, we have an article that entirely focuses on this guidepost. And that means making it easier for people to make choices of their own free will, which we see not as just a yes or no. Can someone consent or assent to research? Can someone, make this choice? But really that this ability to make a choice can be supported by things that the researchers do, by choices that the researchers make. We have a focus on researcher-participant relationships. I've already talked about that quite a bit. We really see this as a relational context, and that those relationships matter for research. We talk about individualization. So making the research process fit the unique needs of each person, not just the respect for holistic personhood, which might think of in general, what needs and strengths might autistic participants have, but also individualization. What's the diversity within that group? What might this particular individual need, regardless of anything else about them or any assumptions someone might make. And then the last one is acknowledgement of lived world. And this is really thinking about the world in which participants live, thinking about how things outside the research process absolutely impact what goes on within the research process, because it doesn't happen in a vacuum. And this is applicable to any context. I've had a student who worked on this in the context of research involving older adults who may have dementia or who may face assumptions about their cognition because of their age. It's, we see it used in a variety of contexts where we're grateful that others have read and are citing our work. But we really applied it within this specific context of autism research or research involving autistic participants. It doesn't have to be autism research. Autistic people may participate in research about transportation or emergency room design or any of those other things that I mentioned earlier as well.
Cool. And so then I guess the purpose of this article was really to kind of dig in with the task force and really kind of unpack these guideposts. Is that was sort of the idea, or?
Yeah, so the purpose of that article, the article published in Sage's Autism Journal, is to really outline how we formed the task force, how we tried to make that task force process productive and accessible, and how the task force as a group, we applied these principles to the specific situation of, autism research ethics, of research ethics for studies involving autistic participants. And we have suggestions organized under each of these guideposts. So not just generally how can a researcher reflect, but specifically within this context, what are the results of that reflection? What might be things to consider, and what might be things to do, like concrete action items that researchers can take.
And I don't want you to have to sort of read the whole article to me, but can maybe give me some examples of kind of some of the stuff folks came up with.
Yeah. So there were a number of suggestions. So first I will say, a number of our suggestions are things that are definitely applicable in every context, but are sometimes not always respected for autistic participants in research. And so we really wanted to reiterate some of these things. So some of the suggestions may sound obvious to your listeners and to you, but have not been treated as obvious in all of the literature before. So things like autistic people have a right to participate in research or to refuse to do so. We know researchers, and researchers have written in another book that Eric Rassen and I have out on research involving participants with cognitive disability and differences, where, researchers might go for younger participants because then they can get parental permission and to sidestep some of that consent and assent process with, consent with adults and assent with older youth, with older children. And so we really felt that it was important to reiterate some of these basic rights within research, the right to participate, the right to say no. We have another point where we talk about the right to privacy and confidentiality, which autistic people are not always granted as much privacy as non-autistic people in their daily lives, depending on their context, the specific situation they're in. So how can the researcher, really try to respect privacy as much as possible? We also had some suggestions that are maybe a little more specific to things that are common needs or experiences of autistic people. So one thing that came up in a lot of different contexts, and we talk about in some other articles in even more detail, are sensory needs. So we had a number of suggestions around the sensory context of research, and that researchers should really pay attention to that sensory context and talk to autistic people about their perceptions of that context. A couple different people, because it can be different. Many, although not all, autistic people can be particularly sensitive to noise, to the volume, to light, to smells. And so these are all things to be aware of in trying to create a sensory-friendly environment. Fluorescent lighting can be particularly stressful, and so trying to have other lighting options. But even beyond that, having options in general is a huge one that had come up. So we can think of some things that are commonly that are common sensory sensitivities, but that's never going to capture everyone's unique individual experience. So our task force members also suggested having something like the ability for people to come in and look at the space ahead of time, and inform the researchers, like, okay, this mostly works well for me, but the bathroom has hand dryers and I can hear them even when we're in this space. So is it possible to be somewhere farther away from a bathroom or something like that? I have also been using in my more recent research, another suggestion from this task force, a pre-interview checklist, an accessibility checklist that says, and we're going to do an interview. Here are some common things that might come up. For example, here are some things I do during an interview that some people like and some people don't like. Make eye contact. Would you like me to make eye contact? Would you like me to avoid eye contact? Do you not really care either way? That sort of thing. And then always have that space to add, what else? What else is there that I can do? And the reason that we do it, the reason that I'm doing it this way, is because our task force members also brought up that it is great to have the opportunity to express those needs, but it can be also a real onus on the participant to always be the one brainstorming, like, how to address those needs. And so I really start with some things I know I can do. Some things I've heard before, some things that are modifiable about the space, or about the way that we communicate. We're having a video chat right now. Do you want the video on or the video off? That kind of thing. But then also having that space, now that I've established that, I've thought about this, I'm flexible. I respect the different needs that people might have. Is there anyone that I'm forgetting? Because it'll never capture everything, but it splits that burden a little bit. So that's one that came up. And we also suggest, if it's possible within the research study, and it almost always is, to allow people to bring comfort items or fidget toys with them. And fidget toys are becoming increasingly popular. They've been much harder to find, or something that was less socially acceptable for a while, which has been a really interesting social change that's happened since I started this research. But just an explicit reminder there that, like, if you can, encourage people to bring things, proactively demonstrate that you're creating a space that's open to fidgeting or any other sensory needs folks might have.
The second secret word is consent.
Right on. I love the whole kind of the idea of the checklist and sort of the proactive piece, because I think you're right. I mean, I think we're putting a lot of pressure, on participants to sort of kind of come up with these. And if there's sort of, a set sort of, environmental modifications that you can just make that aren't gonna matter, aren't gonna affect your research. I know it probably gets more interesting when, and I think especially for folks kind of in our field where they want, it's all about control, and I don't mean sort of from a coercion perspective, but from from an experiment, in terms of experimental control, and kind of having everything kind of similar in both environments, so that kind of whether your independent variable is the thing at work here. And so I could see some pushback on some of these sort of adaptations, whether they be sensory or things like the fidget toys and whatnot. Although I 100% agree, I could see sort of researchers kind of arguing against allowing the child or participant to have those things with them, because somehow that'll sort of mess up the results of the study. But I sort of think if a fidget toy and some and a really loud sort of machine in another room are going to result in sort of challenging behavior, then why do we need to do a study? You know what's going to cause the problem. Give them the fidget toy, reduce the sound. If you're still having challenging behavior, then you can continue your study. If you're not anymore, you can send that participant home with a fidget toy and a set of headphones, and you've got a happy set of parents. So yeah, I think these are really, really valuable and really powerful. I wonder about and we may end up just moving into the kind of consent article as a result of this question, the empowerment article. But I wonder about sort of these. Well, first off, I wonder about the kids, and I think you brought up that point initially, and it resonated for me. The idea that when we recruit children, and many autistic related kind of studies are on kids. Most of them are on kids. In fact, there was a real call for adult research a few years ago, and we're starting to see more now. But for the most part, most of the research is still around kids. And you're right, that recruitment isn't. That kid isn't getting the recruitment letter. It's the parent, and the parent is making that decision. Was there any discussion or kind of thought around the idea of that sort of, like, that seems like philosophically, maybe ethically, like a bit of a dilemma, that you've got these kids that are going to have things done to them, in the context of a study. They're not going to understand what's happening, and they're not going to know, and yet their parents have signed a piece of paper saying they can be in it anyway.
Yeah, so this has been a theme in the autism research ethics literature. Alexandra Perry, in particular, writes at length about sort of autism and pediatric bioethics, and this idea that there might be various conflicts when parents are giving permission for a child to participate in research, particularly if that research is oriented around controversial things like cure or different treatment, or, the idea of what autism is, right? And Perry's work really looks at the fact that the social context in which, many, but not all, autistic people, autistic adults, have different perspectives than many, but not all, parents of young autistic children, or of autistic children in general, or sometimes even parents of autistic adults. And so within that context where there is this conflict, and broader social conflict, cultural conflict about, for example, whether genetic research is ethical, whether one should look for biomarkers, what can one do with biomarkers? Is this sorry to be, to be bringing up, but is this going in a eugenics direction?
Yeah, exactly.
I mean, these are definitely things that people are concerned about, and so within that context, ethicists, bioethicists, may be concerned that the children, when they grow up, may have different priorities than the parents who gave permission. And so some of the suggestions that Perry and others have made for this is, involving autistic adults in the design of the study and in the design of consent and assent forms. And certainly there are general recommendations and suggestions that we can take from pediatric ethics, from bioethics related to research with children, from childhood ethics in general, whether it's medical or not, of really engaging the child, potential research participant, in decision-making around the research as much as possible. Maybe the child is not able to give legally binding consent, but they can still participate in assent, which is the term that we often use to talk about saying yes to research in a non-legally binding consent kind of way, right? So someone else may have to give permission, often, they're not always a parent, but a child can still participate in that conversation, or at least many participate in communication about it, whether it's a verbal conversation or not. It's developmentally appropriate, so it gets more difficult with particularly there are a number of studies that are enrolling people at or even before birth, right?
Mm-hmm, mm-hmm.
And so that can certainly raise new problems that maybe
Right.
can't be addressed as much through just involve the child in a developmentally appropriate way. And that's why there are these suggestions for like involve different types of adults and involve parents, involve researchers, involve autistic people who might be parents or researchers as well, who might have that lived experience that can really contribute to the design of the study and the design of the consent process, and build in those opportunities for decision making beyond just the decision to say yes or no to the
Mm-hmm.
research as well. And that's something that I'm really interested in, that had come up. So we talk about process consent. And so it's not just saying yes or no to the research and then that's it and then it's done. But saying yes at multiple points. So
Right.
checking back in with children as they get older. To see if they're still happy to be involved in the research, building in outs, building in opportunities for people to make decisions as they go along.
And I suppose there's going to be I could see some of that being, not so appetizing, for lack of a better term, for some researchers, because the idea, especially when you're doing some of these sort of more kind of longitudinal kinds of studies, and you have a child sort of 3 years in decide, they don't want to be involved anymore, and having that option to sort of pull out, could mess with your results, and so kind of being willing to kind of go that direction. I also. There's the child piece. There's sort of that age piece, and just neurodiverse or not, just being a 5-year-old child and making big decisions like this is going to be difficult. And so I like the idea of sort of incorporating different ways of assenting and consenting through the process. What about these? This could be adults as well, I suppose. But what about these kids in particular who maybe either have some sort of cognitive disability, or they're just lacking an ability to communicate or whatnot? What hope do they have?
Mm-hmm. Yeah, so we talk about this a lot in terms of like increasing accessibility of the consent process, right? And so one thing that underpins a lot of this is a presumption of capacity, a presumption of competence, a presumption that avoiding an assumption that an autism diagnosis might by default have an impact on someone's ability to participate in the consent process, or that someone should be excluded from research that they would have to consent to because of a diagnosis. This is something that a lot of people have been concerned about, that autistic folks are excluded from research that concerns them. I've read studies on, what is the acceptability of this, this particular type of therapy, or this particular tool that's used in therapy. The therapy's for autistic people, and no autistic people were asked in the study, like whether it was acceptable to them or not. Parents
Sure.
were asked, or teachers were asked, or other people were asked to sort of talk about it. But this is something that's just like so directly relevant to autistic people, and they were not asked. And so that's kind of the first point there is not presuming that an autism diagnosis by definition would make it more difficult for someone to give consent to research or to give assent to research, to be involved in that decision-making process. That said, certainly we recognize that people may have communication differences, may have other barriers that might make it more difficult to engage in the consent process, which, by the way, within research ethics has a lot of other barriers and access issues for anybody. So some of these tips, again, are very useful for anybody doing any kind of research with any kind of participants. So some things that the task force has suggested that can help make the consent process easier, more accessible, empower people to make decisions, focuses on this idea of communicating the information well, and maximizing the possibility for comprehension, because information and comprehension are major components of of consent. So this can include using things like plain language or easy read versions of consent forms. So a consent form for anybody should always have a low reading level, but this may be especially important in this context. An easy read version may incorporate visuals with the text, so presenting that information in multiple ways, having one concept per line. It may take a few more pages, but it's less dense and less, for many readers, less intimidating than like a really tight 10-point font kind of consent form. Some researchers have used addendums to the consent form that present the information in a different way, such as audio visual, like a recording explaining the research and what someone will do. Yeah. And I know of at least one researcher we cite in this study who uses a social story version of an assent form. It's labeled in the paper as a consent form, but it was actually asking for assent, and parents, and I think possibly also teachers, gave permission. And what I really liked about this study was that the researcher, Daisy Lloyd, used a picture system that this research took place in school, that the school was already using. So it was a picture system that was really familiar to the potential participants contextually. So I look at that and I give it as an example sometimes when I give this when I explain the research using slides, and I say, now this wouldn't necessarily be appropriate for the potential participants that you're recruiting. If they don't use this kind of picture system, if they don't use a picture system at all, they may actually find that, really inaccessible or even offensive. But in this context, this is how the potential participants were already communicating. And so that really helps with, understanding the information and being able to answer. The other component that I wanted to bring up that might impact someone's ability to participate in the assent or consent process is more of an experiential factor, which is that in the literature and in people's personal experiences, this comes up that a number of folks on the spectrum have had a lot of experience in institutions of various sorts.
Yes.
Whether sort of capital I institutions, someone talks about being, in a psychiatric hospital or in an institution, or just small I institutions. In the anthropological sense, we talk about, school is an institution, work is an institution. There's a number of institutional forces in folks' lives. And so, in either of those, often in these contexts, it has been easier for autistic folks to just say yes, to please the people in positions of power. Now, I know in a lot of contexts, in education especially, there's a big focus on encouraging people to make choices, and that it's increasingly been integrated, but not everyone had that experience. And so someone who has had an experience where it has always been advantageous to say yes, strategic to say yes, may be more inclined to say yes in a research context. And so, it's especially important, and this is true for any study, and researchers always do this, but in this context, especially important to really clarify that yes and no are both acceptable answers. And, you talked about researchers maybe being disappointed if someone withdraws from a study a couple years in, or, researchers may also be disappointed if someone says no to participating in a study. And I actually talk about this in my chapter in the research involving participants with cognitive disability and difference book. My chapter is called Vulnerability, Empowerment, and Dissent, the importance of saying no. And the point I really make there is that it may be disappointing if someone says no. I mean, I designed my study because I think that it's a cool study and an interesting topic and that it'll help people. But I really try to frame it in that paper, and I find this really helpful in my own work as well, that if some people say no, that means I've designed the consent process really well. It's working because yes and no are both valid options. And so I might even get a little concerned if everyone says yes to everything all the time, because there's lots of reasons why someone might not want to participate in research, and it might be related to the research. That might not be a study that they think is cool or interesting and will help people, it might not be related to the research at all because of that acknowledgement of lived world, that broader context of people's lives. Maybe they're tired. Maybe they have work that day. Maybe they have other things they would rather be doing. And that's okay.
The third secret word is access.
This is so you 2 points I got to come back to here that I think are just huge. First, the smaller one, but I love is the visual support one. So you talked about, because I do see more and more folks are including sort of visual supports and visual aids, often in using a program that a lot of folks will be familiar with called Board Maker, that has sort of these specific kind of symbols, and there's sort of become a belief that every person with autism can totally understand these symbols and somehow they were born that way. But in any case, you've got these sort of symbols in place, and I saw a nice sort of accessible playground photo the other day, and it was a playground and had a wonderful visual board explaining how the playground worked using board maker symbols. Oh, that's a great idea.
Cool.
That's nice. But you make a great point that not everybody in a study or in an intervention or in any kind of setting where you're doing work with autistic folk are going to use that particular visual support system. So I love the idea of, in your recruitment, finding out, how they communicate, finding out what their visual support system is, finding out what their sensory needs are, and so on and so forth, and then individualizing those in your study versus making a broad swipe that everyone's going to get 2x2, board maker symbols Velcroed on a board. And maybe only 30% of them are actually going to use that system to communicate or to sort of understand what's going on. So I just wanted to sort of praise that and reinforce that, because I think that's really important, and I don't think that's something folks think about. With the choice piece, though, this has been something I've just kind of been itching to hear as you're speaking, not to refute anything you're saying, but to support it 100%. One thing about choice that I think we see and behavior analysts see a lot, and I think a lot of behavior analysts also agree that choice is really important, and it's important to include choice in things. But what I think some folks don't understand is that being able to make a choice is a skill. Being able to sort of look at two different options and understand that by using our verbal behavior and emitting the sound that comes out in English as yes, doesn't necessarily associate with an understanding that you're picking the thing on the left. And it could be more, like you said, not understanding the choice and making and just saying the words to sort of appease, maybe an authoritative person or who's ever asking them, or maybe even just to sort of escape having to discuss the question anymore, because when you ask me a question, I get anxious because I don't know what to say. And so just the idea of just sort of giving a choice once, I think is really risky, because a lot of the times I've seen so many times in my clinical work where, I'll talk to an autistic individual, they'll say yes to something, like, you ready to go out to the park and want to throw your shoes on and we'll go? Yes. Because that's sort of the rote statement they're used to saying. And then when you get ready to go, they don't want to go. They don't want to go anywhere. I just want to keep watching TV. I never wanted to do anything in the first place. I don't even know what you mean by the park or what going to the park means. I just know that if I say yes, you'll smile, or something, and that'll kind of reinforce my behavior and I'll kind of keep doing it that way. So I think it's just massively important in research, but I think even more so, in intervention, when I'm sort of speaking to kind of the behavior analyst audience, that, you're taking what Ariel's saying and constantly thinking about giving that choice over and over and over again, and giving different ways of presenting that choice, and looking at different ways of sort of measuring assent, especially, in these young kids. I've seen a lot of talk with some folks lately that I like, that are doing some good work, where there's been a lot of talk with some younger behavior analysts around how to incorporate assent into sort of early intervention. And,
Yeah.
every time the child avoids the table, you don't make them sit at it, or every time the child starts, maybe crying or screaming or whatever when you're doing some sort of task, that's probably a hint that maybe at that moment they don't want to be involved in that task. So I think not really a question here, but I just really think that it's super important.
That's what I was going to ask you is, in that context, when someone says yes, but doesn't want to go to the park, like, how do you know they don't want to go to the park? What do you notice?
Well, yeah. So, first off, it's a refusal to not getting off the couch, or you've put you've handed them their jacket and they've thrown it on the chair, or they actually, or maybe they engage in some sort of challenging behavior and they get aggressive or whatever, because you're trying to sort of push the issue. So you see behavior that indicates no, even though they verbalized yes.
Yeah. And this is something that we also recommend and have seen in the literature, researchers will talk about, is really paying attention to those nonverbal signs. As much as we can. Some of us right now are doing research that is only verbal because we're not face to face. But if you have the opportunity, or use whatever communication you have, there's even nonverbal in non-face to face. If someone stops responding to me, stops writing me back or something like that. To really pay attention to those nonverbal signs. And this can be really helpful also if, for whatever reason, the person's involved in research but didn't go through the consent process. They're too young, or it didn't have capacity to consent for whatever reason. But also for folks who did go through a lengthy, consent or assent, that's part of that process consent. It's just monitoring for other signs, for nonverbal signs that someone doesn't want to do this anymore. Yeah.
Cool. Yeah, and again, just for folks, I'm going to have links to all these articles. This initial person-oriented research article and the empowerment decision-making article, they both have really great sort of tables that really give lots of really concrete examples about sort of what to do in different situations of different sort of phases of research, planning throughout. What to do when you're sharing the research as it relates to all of these guideposts, and a really powerful tool. I might even, make up a little sort of, if maybe over the holidays, if my brain wants to make some, some Instagram kind of, posts, kind of sharing some of these suggestions to folks, because I think they're really powerful.
Cool.
But looking at sort of the time as we're having a discussion, I do want to just kind of slide over to this one other article that the team did around intersectionality, because this is another really relevant and important area right now in behavior analysis in particular. A lot of folks are talking about this now. Some folks don't see any importance to this whatsoever. It doesn't matter, that sort of thing. We're all the same, blah, 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 and that's, I'm not speaking to those folks necessarily, because there's probably some bigger discussions there, but, just could you tell us a little bit about this article and kind of what you were looking at and kind of and how intersectionality is so important in research?
Yeah, so I know you've talked about intersectionality on the podcast before, but just in case anyone's listening to this one as their very first introduction, just to start with like a definition of intersectionality. Intersectionality is a concept, a term was coined by Crenshaw, a Black feminist author, legal scholar, working at the intersection of race and gender, although intersections can refer to, any identity or category someone finds themselves placed in, whether they identify with it or not. And what Crenshaw looked at in terms of law that I think really clearly highlights what intersectionality is. It's that intersection of race and gender and the way that power differentials in society are experienced intersectionally, not additively, not just as someone might experience racism and sexism, but that combined racism, sexism is distinct. So, Black men experience anti-Blackness in a different way than Black women experience anti-Blackness, or what's sometimes called misogynoir. And the legal example that I think makes this really clear is Crenshaw looked at legal cases where employment discrimination cases where the ruling was, Black women not getting promoted or not getting hired, I forget which it was, in this organization isn't sexism because other women were promoted, and isn't racism because other Black people were promoted. But Crenshaw saying it's intersectional. It's intersectional racism, sexism. It's a particular experience that is still discriminatory but is erased, and so that's how we use intersectionality, particularly in this paper, is to consider who is erased from autism research. So I mentioned earlier that we were really concerned with studies, excluding autistic people. There may be certainly risks to participating in a study, but there's also risks to not participating in research, or to research not including diverse participants. And so there is increasingly a lot of research that involves autistic people, autistic adults, as you had mentioned earlier, the perspectives of autistic people, not just the genetic material, for example, but really looking at things that are important to people. Not that genetics aren't important to people, but perspectives and experiences. There are still, however, some autistic people are more represented than others. So there's broader cultural stereotypes of autism, particularly in North America, as being linked to masculinity and whiteness and high socioeconomic status, some of which is an artifact of sort of where autism was diagnosed in a university center that may have served primarily white, higher socioeconomic status folks. And sometimes the research can, inadvertently reproduce these stereotypes, or sometimes, advertently reproduce these stereotypes. And for researchers, I think there's really a tension here between, in terms of sampling, wanting the sample to be specific enough that the interpretation of results is more clear, but diverse enough that the results are generalizable to a broader number of people. This concern that, a study that only included white men or white boys might not be applicable to all autistic people, right? And so in this paper, we really run through what has been written in autism research ethics, and inspired by our conversations as well with the task force, in terms of the intersections of autism or autisticness or disability with sex and gender, with socioeconomic status, with communication. So we talked about people who communicate verbally or not verbally, and with culture, or different things that sometimes get glossed as culture. We talk about culture and language and geography, a number of different things that get brought up. And again, finding, unsurprisingly to anyone who is engaged with intersectionality, that folks who are marginalized elsewhere in society are also marginalized in the research process, and specifically maybe erased in the research process. And so, a lot of the point of that article is really encouraging diverse recruitment strategies, and there's also some specific suggestions that we have in there. So, for example, something that many researchers and autistic people and advocates have been talking about lately is the intersection of autism and gender nonconformity, or diverse gender identification. And so, one easy suggestion there is maybe allowing a more open-ended gender identification or more inclusive gendered language in recruitment materials, because someone, it may be completely unintentional exclusion. It's not that the researcher sat down and said, I really only want male people to participate in this study, but the language only gave male and female options. And if someone doesn't identify with either of those terms, they may say, oh, well, the study's not for me. I don't see myself in this study. Or, if the study says we want to recruit, women with autism, people who don't identify as women may not participate in that study, even if it is trying to address that women with autism are underrepresented in research. So this is just one of the many suggestions that came up in there in terms of just having the process, the research process, take into consideration the diversity in autism and autistic communities, and try to avoid, unintentionally sort of creating an assumption about who's going to participate, but intentionally thinking about the diverse needs that folks may have for access to the research process on intersectional grounds.
Well, and I think about that example you just gave, and I mean, even sort of the research questions, can be, reevaluated, using this article. I mean, maybe we shouldn't even be asking the question, are women underrepresented, in whatever, because it's no longer, there's no longer just two categories, not that there ever was, but there, there was only, for a long time, there was only two that were, sort of recognized in kind of mainstream media. And so, I think it also speaks to sort of, reevaluating the kind of research you're doing and the questions you're asking. Yeah, really cool. And again, it's all the articles that we're going to share on in the show notes today are really nicely formatted and kind of well laid out, so that and I don't know if this was intentional as well. I mean, there's some stuff in here, like some of the tables that are, tables are always going to be sometimes, smaller print and maybe more difficult to follow, but they're nicely categorized. They remind me, there's a journal in behavior analysis called Behavior Analysis in Practice that a lot of folks published in, and I've always liked that journal solely because of the visual display of the articles that they put in there, and they just make them really, accessible, and so
I'll check it out.
Yeah, I find that your research is also just really accessible for just reading and kind of I can just flip over to page. Well, I guess this one doesn't have a page number, but I can flip over to page blah and see the the race, ethnicity, geography, and language sort of intersectionality section, get an idea of some suggestions there, and kind of incorporate those. And I also talked about those tables in the other paper, which are really helpful. And I think this is the kind of research that needs to continue to happen, that gives practitioners, really kind of concrete action steps that they can take and kind of take forward. And I think that's a lot of what your work is doing. So I just want to say I really appreciate that.
Thank you. Here's to hoping.
Yeah. So really, really great series of articles and a really interesting discussion today. What are the next projects? What are you working on now? I know you're no longer. I don't think you're in Canada anymore. So you're back in the States. So what kind of work are you doing these days?
Yeah, I am no longer in Canada, although I'm pretty close for someone in the U.S. 2.5 hours from the border.
Yeah.
So I didn't stray too far. But I've been in Michigan now since 2019. So I started this position at Central Michigan University, and as I mentioned before, I do a lot of teaching. I teach ethics and social sciences to medical students, and I'm still continuing research on issues that are important to autistic folk, and on this idea of sort of the autism concept, of social world, and ethics. And so I'm still continuing some of this research, still, talk with many of my colleagues from this project on ways that we can really incorporate these suggestions into new studies moving forward and continue that collaborative and deliberative process. So, keep an eye out or an ear out, keep your senses open for more things to come on this project. And I also implemented in just my everyday life and my everyday work. So my research now, I've got kind of two new things in the works. So one thing that has come up across pretty much every study I think I've done involving autistic folks and people who care for them, care about them, is employment. And transition to adulthood in general and employment specifically. So, of course, this idea of the services cliff or the black hole of services after someone is no longer receiving services from school. So what to do there. And a lot of people's concerns revolve around work and home. So finding a good place to live, finding a good way to engage with work or not engage with work if work might actually be terrible. And that's something that I really try to keep open to in my research as well, is there's a sort of critique of capitalism that underpins a lot of this as well. But hoping to very, very soon speak to folks across Michigan about autistic folks across Michigan about their experiences searching for a job or having a job.
Cool.
And particularly looking at different ideas about what autism is and how autistic folks and non-autistic folks are similar and different to each other, and how those ideas might inform how autistic and non-autistic folks work together in different contexts. So I think that's going to be really, really helpful, really cool.
I think it is too, and I hope we can kind of have you back on to talk about that work.
Absolutely.
I have a personal interest. The company that I work for that's also supports this podcast. We have kind of two departments. We do primarily positive behavior support on one side, but the other side, for 30 years, we've been doing supported and customized employment for folks with autism and other disabilities. And so, I think some of this information is going to be really valuable. I was doing a little Googling just as we were finishing off here, and noticed that Central Michigan does actually have a behavior analysis department. Have you ever been down to the building and had any conversations, or?
Yeah. So I think we might actually used to have shared a building, although our psychology people are split across a couple different buildings, I think. So not sure where the students are, but I do know some of the folks in the psychology department, and we talk a lot and work together on different projects, very campus specific projects as well, working on meeting the needs of autistic students, as well as working with the community. And actually, that's the other project that I have coming up, is a very local, but hopefully to inspire international work, is that I am co-PI on a study from the funded by the Josiah Macy Jr. Foundation. Nellie Regina is the principal investigator there, and this study aims to increase disability studies and to bring together some of the disability studies work we have in the medical school. So training medical students to work with patients with disabilities, not only autism. But we have a task force or an advisory board for that project, where we're really working with community members who identify as disabled, have a disability, or work with folks who do, to keep that education as experience as close to lived experience as possible, and really fill that education need.
That's really cool. Really
yes,
cool.
Fantastic.
Yeah, looking forward to seeing some of that as well. Ariel, this has just been a really fascinating conversation. I want to say, so for our behavior analysis listeners, we offer CEUs on this podcast, and I'm going to offer ethics CEUs. I know the board likes to kind of have a connection to our ethics code, and I know you're not familiar with the BAC. Well, maybe you are, but we didn't really talk about the BACB ethics code. Didn't really kind of go there and kind of confuse things for you. But what I will be doing is including in the show notes all of the relevant sort of ethics code items in our code to the discussion we kind of had today, so folks can kind of see how the work you're doing, applies ethically to the work they're doing. And so we'll share that with folks as well. And they can also come home. I think this will be the first episode in the series so far where I've been able to offer an ethics CEU. So thank you for that as well. So that's fun. Yeah. So yeah, just again, wonderful having you on the podcast. So glad you're able to make the time and look forward to kind of seeing some of your future work and bring you back again.
Thank you so much for having me. It's great talking with you today. And thank you to everyone here who's listening.
All right. Cheers.
Cheers.